Hi, everybody. Welcome to the 10th episode of the Wedding Jigsaw podcast. We're in double figures. Now, today is going to be somewhat different. The whole idea of the Wedding Jigsaw podcast is to bring suppliers to you, people who supply their services in the context of weddings, and let you get to know their personalities to see how you feel about working with them. And today I'm going to take you in a completely different direction from anywhere we've been before. If I was to say to you, a smile is for life, not just for your wedding, that might give you some idea of what we're going to talk about today. I'm going to introduce you to a dentist, an orthodontist, who is based in Whiteabbey in County Antrim, and he provides routine and cosmetic care. He's learned from some of the best dentists in the UK and Ireland over the past 12 years. He has extensive training in cosmetic dentistry, including teeth whitening, composite bonding, I have no idea what composite bonding is, and cosmetic orthodontic treatments. So folks, please welcome Conall O'Doherty. Conall, you're very welcome.
Thanks very much for having me, Donald.
Great. So Conall, is it fair to say that over the last 15 or 20 years or so, people have been taking much greater interest, not just in the health of their teeth, but in the look of their teeth? The smile has become paramount.
Absolutely. I mean, I think that most people have always had an interest in having a nice, bright, white smile, but have maybe felt a little reticent about approaching dentists or weren't fully aware of all of the treatment options that they've had. But absolutely, over the last decade, and especially over the last 12 months even, we've seen a massive uptake in interest in people looking to come forward to improve their smile.
What would you put that down to, the last 12 months? Do you think it's the fact that people are in the house and looking at mirrors more often, or what?
Yeah, well, I think that even this experience that you and I are having is very much part of it. People in Teams meetings and Zoom meetings, and quite often there'll be a little box in the corner with their own smile looking back at them, and they're starting to see their teeth in scenarios where they wouldn't usually see their own teeth. Most people, whenever they look at their own teeth, they're basically just looking at themselves in the mirror whenever they're smiling and whenever they're brushing their teeth. But they're not always fully aware of how they look in conversation and from different angles. And over the last 12 months, I think a lot of people have become a lot more aware of that.
Fair enough. Yeah, I suppose so. I mean, my memory, my thought was the American television shows of maybe 10, 15 years ago. All the films started these big white, gigantic white teeth, which were nearly a distraction. They were so white, you know. As soon as the smile, the room was nearly blinded you. But I'm noticing now a lot more people in public here have got not falsely white, but nice, clean white teeth. It's much more noticeable.
Yeah, and I think that certainly in the UK and Ireland, I think that people in general here don't really want to see that wall-to-wall, here's my teeth. People want to look like themselves, but they want to look well. And people want nice, straight, white teeth. But I think what we as dentists want, and what people really want, is a healthy smile. And that a healthy smile shines through on its own. And I think that people would much rather look like themselves on a good day than someone with a false looking smile.
Yes. One of the things I've noticed, Conall, is lately, I mean, when I was having this conversation last night, years and years ago, you saw children, maybe anything up to teenage years, maybe early teens, wearing braces, but you never saw adults wearing braces. Now you see adults all the time wearing braces, people in their 30s and 40s wearing braces. And I mean, I've always found my reaction to that is kind of, that's weird, but it's not weird because it's normal. Is this because of a change in the things being more modern, better techniques where it's easier, or is it just a thing that people discovered they can do it? I always thought you had to straighten your teeth when you were young and still developing, but obviously not.
Well, no, I think there's a few factors involved in that. One of them is just what you've said, is that I think that people thought it's something you can only have whenever you're young, whenever you're growing. You get one go at it, and if it doesn't work long term, well, that was it. But I think that people now are realizing that, oh, okay, maybe I've had some orthodontic treatment in the past. Maybe it's my teeth have started to move again. I can probably do something about that. And I think that people are just much more aware of that being a possibility, and also the new techniques, which maybe aren't necessarily brand new, but are certainly a lot more accessible amongst general dentists than maybe they used to be. And there are a lot more avenues for patients to access these treatments. And we now have much more readily available discrete options for straightening your teeth as well. And all of that, when people, I think, realize that they can have something like that, it just opens up those possibilities for treatment. And yes, you're right. I mean, it's very normal now to see adults with fixed braces on their teeth, and there's no stigma really, I think, attached to that anymore. Whereas maybe 20 years ago, it probably would have seemed a little bit odd to some general population seeing someone with braces, whereas now it really isn't. It's a very commonplace thing. I think that people are more focused, I think, on the end goal than a very short term look of having some braces on their teeth. And I think that when people see someone with some braces, I think they know that they are doing it to improve things. And they're probably going to be a lot more encouraging and supportive of people wearing braces than maybe going to say something.
One of the other things I've been surprised at, and I don't know if this has changed or I just didn't know, it seems to be that you can, as an orthodontist, you can bring on change much quicker than generations ago. Is that right, or is that just a misconception on my part?
That's possibly a slight misconception. So just to be perfectly clear, I am a general dentist who does some orthodontic treatments, so there will be a slight difference. I must stress this between myself and specialist orthodontist. There will be certain cases which I will refer on, so I just need to get that out there.
Fair enough.
I think that, yes, you're right in terms of timescales. Whenever you are growing up, most orthodontic treatments sort of take between 1 to 2 years. Whereas some adults who are having maybe more minor treatments, the tooth movements that are being planned are maybe not as complex. They're maybe more minor. They're perhaps just recorrecting previous movements. So the overall treatment plan should hopefully be shorter. So yes, you can potentially have your teeth straightened to an extent in a very short space of time. But again, it really depends. Every patient is absolutely different. It depends on where you're starting and where you want to finish. Whenever we have a patient in for a consultation, what we're trying to discern is where you are and where you want to get to. If you are a patient who has maybe never had orthodontic treatment or has had significant relapse or a lot of dental work, and you really, really want to get quite a big transformation in your smile, then that is going to take a lot of time. And that's always been the case.
Define a lot of time. Are we talking years, or are we talking what?
I mean, I would potentially, certainly for complex orthodontic treatments, that could take 2 years. It really depends just on, like I say, where you're going and where you want to get to. But for other patients where there's maybe just been a little bit of tooth movement, a little bit of tooth wear, it may not take very long at all. And I've recently completed a few cases that have taken 4 months.
Oh, right.
But again, there are other patients where we start at the same time, and we'll still be doing that treatment several months from now. But yeah, it really depends on where you are and where you want to go.
Yeah, it's really down to the individual very much then.
Yeah.
Yeah, fair enough. So, I mean, let's sort of take an overview. What sort of, from the point of view, I'm talking really brides and grooms, but obviously this applies to everybody, as you pointed earlier on, even the guests. Everybody wants to have a nice smile. But I'm thinking the bride and groom, this is their big day, and they want to look their best. So what exactly can you offer them, or what's, as an overview, what can you offer them to help?
Okay, well, following a little chat and a consult and examination, what we'd be offering is potentially straightening of teeth. We can offer whitening of teeth. We can offer composite bonding.
I do not know what that is.
So, I mean, that's taken various names over the years, but essentially that is minor reshaping, retouching of the teeth with some white filling, essentially, which would be a very effective and very minimal tool. And beyond that, there are more extensive treatments as well, such as crowns and veneers. But what we'll always try to do, or what I certainly always try to do for patients, is to see how little can I do to your teeth to get them looking the way that you want them. So we'd always try to look at the color of the teeth, which is usually the simplest thing for most people to change. So when we're talking about the color of the teeth, professional teeth whitening is a very tried and tested treatment. So that can be done in a couple of months, usually with professional custom made trays. We take impressions of your teeth, make sure your teeth are suitable. There are certain instances where you can't have teeth whitening. Predominantly, I mean, if you have a lot of dental work at the front, if you have a lot of old crowns and veneers or lots of fillings, those dental materials will not whiten. So you're looking at whitening just the natural teeth. And there are some, I'll not get into them, some rare conditions where the teeth themselves do not respond to that whitening. But unless you chat to the dentist, you don't really know if that's going to be suitable. But it's a very safe, very effective way of improving things. And it's often one of the first things that we look to do. Some people will come in looking, and they might think that they want all sorts of treatment. You may just whiten the teeth and patient's happy. And that's great. We've done very little and we've got a good result. And in the past, I have planned treatment involving several different things. And we've said, we'll try whitening teeth first. And we've done that. We've had a look 6 weeks later and patient's happy and we don't do anything else. And that's fine. So in a sense, that,
no,
sorry, I don't know.
No, I was going to ask you, the teeth whitening, Conall, does that happen mostly in the surgery, or does that happen at home?
Predominantly at home.
Right.
The most common way is at home professional teeth whitening. So we would supply you with your custom made trays and the appropriate gel to use either during the day or overnight. You do that most days or most nights for a month to 2 months, depending on how white you want your teeth to get and how quickly your teeth respond to that treatment. And most of that is done at home. There is also the opportunity for in-surgery whitening, usually done with a product called Zoom from Philips, would be the most commonly known one, where we kickstart your treatment in surgery with a whitening treatment. And then you follow up with some home whitening for approximately a week. And the end result should be approximately the same. But the second option is maybe more suitable for people who don't think that they're going to persevere with the entire work themselves and maybe want a little kickstart from the dentist. But that would be a lot less common than home whitening. Home whitening has had millions of patients around the world have had it done. It's safe, it's effective, and it's pretty predictable. So most commonly done, yes, at home whitening.
That's brilliant. Okay, I interrupted you, or you're about to tell me about something else.
Very positive. So whenever we're looking at the color of the teeth, we're also looking at the position of the teeth. And we've already alluded to it as well in terms of orthodontics. So we have in the practice, we have so many calls on a daily basis asking about options, about products such as Invisalign, and 6 Month Smile would be a very commonly named brand towards us. What people are really asking for is, how can I make my teeth straighter? And that can be done in a couple of ways. It can be done either with fixed braces. So the most people will be very familiar with what a brace is. And that can be done with metal brackets, or there are also ceramic brackets, which are tooth colored. and we can use wires with a tooth colored coating, and the little ties as well can be tooth colored, and that can make things, although not invisible, can make things a lot more discreet than you would imagine. And having fitted quite a lot of these for patients over the years, we do the bond up, we get the braces on the teeth, and we show patients the mirror, and you can see the trepidation in the face as they bring the mirror up, and then they smile, and then they go, "Oh, that's okay." Usually pleasantly surprised. Yeah, so it's and we have some people who would come in, no, not all, who would say that some people didn't realize that they had braces on their teeth. Wow. But we don't know how close up they're getting, I would say. So that's fixed braces, and what that involves is you have a treatment plan with the dentist, and you usually attend the dentist every 4 to 8 weeks for reviews and for tightening and changing of wires, etc. And you can usually see a nice gradual improvement as you go along. In terms of removable braces, which is what most people are asking about these days, and the aligners, and the most well-known brand for that, I suppose, is Invisalign. Invisalign is, I stress, not just one particular brand of product, but it is extremely effective. So what Invisalign is, are little retainers, so little plastic trays which fit over your teeth. They are made in such a fashion they apply very light forces to your teeth to try to move them in the direction that we want to go. You wear them full time. You take them out only to have something to eat, to drink something that's not water, and to clean your teeth. You wear each aligner usually for 7 to 10 days, depending on which product you're using and the goals of your dentist. And you usually see your dentist every 4 to 6 weeks for review and for minor adjustments that are required, and then delivery of the next batch of aligners. Now, Invisalign and aligner treatment is usually more suitable for minor tooth corrections. If you have something which is maybe a little bit more complex, you're generally better having fixed braces on your teeth. It will usually take a little bit less time, and you're more likely to get a satisfactory result. But your dentist will examine you and will put the options forward to you in such a way that we try to give you the best option for yourself. I'd say that almost every patient that comes to me for orthodontic consultations will come in and say, "Yes, I'd like Invisalign, please." But what they really want is straight teeth. And sometimes it's about just educating the patient as to what is the best way to get that. And sometimes that will be with removable appliances such as Invisalign, and other times it may be with fixed braces.
The one question I know people are thinking, does any of this hurt?
Some discomfort can be expected whenever you have a brace fitted, or shortly after, maybe if you have things tightened up. But generally speaking, the pain levels are very low. I mean, we're not doing awful things to you. We're not, most treatments involved that I'm talking about with you today, the majority of them are things that we can do where we don't have to give you an injection to anesthetize the mouth. Quite often we don't have to lift a drill. We're trying to do, as I maybe said a little bit earlier, as little as possible, to you to get where you want to be. You said, I suppose, at the start, a smile is for life, not maybe just for your wedding. And I, fully endorse that, and that this is your dental capital. We want to keep as much of your teeth there as possible, and we don't want to drill it away. And we want to do things as pain-free as possible. What I would say, no real pain as such, hopefully, and certainly nothing that couldn't be managed with occasional simple over-the-counter paracetamol or ibuprofen. But even that, a lot of the time, isn't necessary.
Well, that's good. Glad to hear that. Well, the one thing that comes across here is, there's a time factor involved, Conall, and the time factor for the treatment. And I also know that you are extremely busy. So, I mean, there's probably the time factor involved in actually getting the initial consultation. What sort of lead-in are we talking about?
Well, at the minute, I suppose now in 2021, post-COVID, the landscape for all of us has changed. Dentistry is not unaffected by that, and it's been well publicised of the difficulties in accessing dental care last year, and we're still dealing, and will probably be dealing, with some of that for some time to come. Now, things have improved greatly. I know myself, I think you're probably, and although this can vary massively from month to month, you're probably looking at a month, perhaps before you can have maybe an initial consultation, worst case. But what I would say in terms of time is you don't really know exactly what your treatment's going to be until you chat to your dentist. And your dentist isn't going to know how long it's going to take until they chat to you. And it's important to go as soon as possible. I remember whenever I got married 3 years ago, and I think we got engaged 2 years prior or thereabouts. And the planning starts straight away. You're looking at the venue. You can't expect to get a wedding venue 3 weeks from from deciding to get married. Even getting a suit was several months of a wait time. And I think that if you're planning something with a deadline in mind, just give yourself as much time as possible. So if you are thinking about getting married and you are thinking about doing something with your teeth, schedule an appointment as soon as you can, because it may be something that can be done very quickly. It may even just be some proper cleaning and hygiene of your teeth can make a big difference, and that's one day. And other people, maybe if it's more complex treatment, it could be a couple of years. But most people, thankfully, we can sort out in a much shorter space of time. But you've just got to give yourself the time to do that. And I know in the lead up to a wedding, although it's a fantastic time, it can be a very stressful time. And you don't want to maybe add in another layer of rushing to get your teeth done as well. Factor yourself in a little bit of comfort time.
Yeah. Another, just when you talk about time, Conall, all these treatments and whatnot, they're obviously very effective. Are they permanent, or can they regress, or what?
Well, that's a great question, and it's a very important one in terms of, I suppose, if we talk about orthodontics, most of the patients that I treat are adults who've had previous orthodontics that has relapsed. And what I say to everybody, at the consultation, is the biggest risk of the treatment is that the teeth just move back again or move away from where they are. So I certainly personally insist on strict future adherence to wearing retainers for orthodontic treatment that you wear pretty much every night for as long as you would like your teeth to remain straight. And we'll often recommend as well a little bonded retainer, a little wire cemented just in behind the teeth, just to help give us a little bit of extra security. And there have been studies that have shown that up to 70% of cases who don't have proper retention will relapse again. And we do see that borne out in general practice. We do see so many patients who maybe haven't worn the retainers in the way that their orthodontist has advised, or perhaps they saw their orthodontist so long ago that they can't remember what the advice was, and the teeth have moved a little. So no, absolutely, in terms of orthodontic treatment, it is something that needs to be retained, and it does need to be monitored. You need to continue to go to your dentist every 6 to 12 months after, just to have the treatment monitored and make sure your retainers fit, and to have any repairs done that need to be done. If we chat about other treatments such as teeth whitening, the teeth whitening is usually something which can be topped up again very quickly. You can expect the effects of teeth whitening to last for months after you've had it done. If you haven't had major dental work done, it's usually just a case of getting a little bit more of the appropriate gel, putting it in the trays and topping up for a few days prior to an event, maybe such as a wedding. And for things like composite bonding, where we're bonding little bits of material to the teeth to improve the shape, that can be a very effective treatment. However, none of the dental materials that we use are just quite as strong as your natural tooth. So these things can wear down a little bit over time. So we would say to people that they may need a little repolishing, perhaps maybe every 12 to 18 months, whenever you're maybe just in for a routine dental examination, or the work itself may need to be recycled, perhaps in maybe 5 years or so. Now, again, it varies massively from person to person. It depends on how maybe much you grind your teeth. Some people may have it done once. It may never need to be touched again. Other people may need to have it done or re-looked at every couple of years or so. Yeah, so I mean, whenever you're having these treatments done, it is important to know that what are the long-term effects. We do see some, especially in the last 3 years or so, we've started to see some more extreme smile makeovers coming into the mainstream. There are certain television shows which have young people who've maybe had quite extensive treatments done to improve their smile. For young people especially, we would always try to see if we can do much more minimal things to their teeth. I don't think that, well, I would certainly hope that patients who are having those sorts of more extreme treatments are having the long-term implications explained to them. You know, what happens when we drill down your teeth a little bit? How long will that work last for? What happens once that work starts to fail? What's the next option? How long, will I keep my teeth in that position? So I would certainly hope for those more extensive treatments. I would certainly hope that those conversations are being had. And I would always try to have a conversation with people about what's the long-term outlook for your smile, for the health of your teeth. And like I say, try to do what's ultimately best for the person in the dental chair.
Fair enough, that makes sense. Funny, you just mentioned a word or a phrase there that caused me to start thinking. I mean, coming up to the wedding, as you know yourself, it's a very stressful period of time. There's all sorts of pressures and whatnot. And quite often stress manifests itself in teeth grinding. Do you find that a problem? Do you find people coming to you with a lot of that issue?
Yes, and actually this year, it's really been quite startling. There's always have been patients who have ground their teeth or clenched their teeth. I clench my own teeth quite often. If I maybe have a long treatment appointment, I catch myself just clenching. But it's been an incredibly stressful 12 months plus for the world's population, and we have so many people coming in now with saying that their teeth are sore all over, they're sore muscles, their headaches, jaw pain, through clenching and grinding their teeth. So yeah, that's a big subject on its own to talk about, but it is something that we certainly see an awful lot of, and we're having to do a lot of protective treatment for a lot more protective treatment for people, I would say, now than we probably even had to do 3, 4, 5 years ago.
So you can do something like that, though, protective treatment.
Absolutely. Like I say, that's a big subject.
I know it is,
but,
yes.
Fitting patients with a little bite guard, which is somewhat, can be similar in some ways to, I suppose, a sports gum shield is what people tend to think of when they get that. They come in various forms and they're slightly different to that, but just a way of separating the teeth, reducing the power that you can generate with your muscles when you clench your teeth together, and then hopefully relaxing the entire jaw and muscle system afterwards. And yeah, if you're grinding your teeth down, you can damage your teeth, you can chip old fillings, you can wear down your front teeth, you can crack teeth, and we've had instances where patients have cracked teeth and the teeth have had to be removed, and thankfully that's not all that common, but it does happen, and we've seen so much of that this year. Yes, Donald?
Yeah, well, I was sort of where I was coming from, Conall, was how do the two things work? Because someone coming to you with looking for cosmetic, they're getting married in 2 years' time or whatever, and they're getting their teeth realigned and so on, and then the stress of the wedding starts to build up, and they start to grind, does the one work against the other, or just complicate everything beyond all thinking?
I mean, it's a factor we take in. What we try to do whenever well, certainly what I try to do when I straighten patients' teeth is that I'm not just trying to build a nice smile, I'm trying to build a nice, healthy, functional biting and chewing system. So what we'll often see in patients where maybe the teeth have started to fall in and become less straight is whenever those teeth can become less straight, you can start to wear them down a little bit more easily. So a lot of the time, what we can do is if we re-straighten those teeth and perhaps restore the edges with some composite bonding, is we're hoping that we'll get your teeth to fit together in a better way, so that whenever you chew, we're not going to be grinding our teeth together, that the teeth deflect away from each other. And hopefully, in the longer run, the effects of any grinding on your teeth will hopefully have a less impact on the shape and the function of your smile. So that's usually one of the things that we're trying to achieve. And part of the training which I have done in the past is exactly that. You know, I'm trying to build not just a nice smile, I'm trying to build a well-functioning chewing system that can better withstand those things. But often what we do whenever we do work is we will protect things with a little bite guard afterwards, especially if you know the big day is coming up, just so that if you are starting to get stressed about, you know, the cake and is the band going to turn up and that sort of stuff, that, you know, you can put your bite guard in and protect the teeth during that time.
That's brilliant. That's cool. Well, I think we've covered everything I mean, I'm relying on you here. You're the expert, not me. Is there anything else that fits into this category you'd like to mention?
I mean, I suppose the big thing is that in terms of when patients come to see us for things, ultimately our first job is to look after you. Go to a dentist, come see us, tell us your concerns, tell us where you want to get to, tell us about your previous dental treatment, and then we will, using that information and the information that we get when we take photographs of your teeth and look at the teeth, is with you, we'll try and build your plan to make you as happy as possible. You know, that would be the big thing. Is, you know, dentists, I've been lucky because I've never been scared of the dentist. I was very lucky growing up. I had a lovely dentist, and you know, I was always good with that. But I know a lot of people think that we're terribly scary people. We're usually not. We're just like you. We're just sitting on a different chair and wearing a big mask. And we want to look after you, and you know, we want to make you feel confident about smiling, and you know, not something that you don't want to think about. So you know, we're not as scary as you might think, and a lot of the things that, you know, we can do to help you out, you know, are not as painful, are not as frightening as you think it might be. You know, there's nothing that can't be sorted. I've always thought, so it's just a case of going and finding out what your options are.
Yeah, I think one of the great developments in dentistry from a patient's point of view is that the patient can feel more involved now with the treatment, the cameras and stuff like that. You know, instead of the dentist sort of telling you what he was going to do, you can actually point out on a screen, look, that's what I'm going to do. And that's brilliant, because you feel invested even more so when you are.
I think that's a great point, because certainly whenever I started practicing, I had old patients and they were just used to maybe going to the dentist and sitting down. Dentist says you need 2 crowns and 6 fillings, and you say, okay, dentist, and you come back and you get the treatment. Well, that's it. But I think that in terms of not just in dentistry and healthcare, you know, overall, things are going to happen to you, and you know, most people would like to know what that is and why that's happening. And you don't need to know all the nuts and bolts of everything, but you know, just a little explanation. And the technology that we have now with, as you just mentioned, cameras We have little 3D scanners as well in the practice where we can take basically a digital impression of your teeth. We can show you teeth on a screen. We can show you the position, the wear, and we can show you how we can move those teeth around. And yeah, it's just a better way of involving people. I think if generally, if you're going to see any professional about anything and you're getting their opinion, I think that you would like to feel involved in that decision-making process. That's certainly what I always try to do myself, is I try to think, right, okay, I've got to remember I'm not a dentist, or I am a dentist, but this patient isn't a dentist. So I've got to say, look, what's the issue? And these are your options, and try to put the best options towards the patient. Ultimately, let you guys decide what you want to do. You know, we won't hold you down and make you have braces. That's not it. It's a case of, you know, letting you know what's happening, what could happen in future if you do treatment, if you don't do treatment, and then leave it up to you guys to decide if it's something that you want to do.
Yeah, no, I think it's really important to sort of re-emphasize that bit about the cameras, because people really can see it. It strikes me as you go to, if you want to go and put a new kitchen in, you know, they'll ask you for the dimensions of your kitchen, and then you go and look on a computer screen and they build a kitchen for you, you know. And if you say, no, I don't like the color of those doors, they change the color of the doors, you know, and you can actually see how your kitchen's going to look. And you're almost at that same situation in the mouth, because you can take a picture, as you say, and can you actually show what it would, you know, where the movement would go, what it would look like to a point?
Yeah, we can, and it's a big part of the treatment planning and treatment consenting process, is that for orthodontic treatments, certainly for my patients, I will always, before we decide that we're definitely doing treatment, we will have a little digital model of the teeth where they are, and the teeth over here, you know, where we want to put them. And say, if we take you from here to here, how would you like that? Is that something that appeals to you? Or is there anything here that you want to change? Do you want to move this bit here? So move this bit over here. You know, to try and give you as good a look at what you're getting as possible. Because it's a big leap of faith for people, you know, as well, to come and get this. And a big, you know, people have a rough idea of what they would like to look like. But you're putting a lot of faith in the person delivering that care, and it helps massively if you have an idea of what's going to happen. I agree, absolutely, and that is something that, you know, that I do for all my orthodontic patients, and for other patients having non-orthodontic work. If we're maybe doing some tooth reshaping, what we'll sometimes do is we will mock that up on a little set of your false teeth over here, and then we can sort of temporarily transfer the shape of those teeth into your own smile and give you a mirror and say, look, obviously this is a very rough mock-up, but if we give you a smile like that, is that something that you think you'd be happy with? And it also gives us an opportunity to see what that looks like in your mouth too, and make sure that we're happy with it. And yeah, I mean, I think it's very important to where possible offer that to people. And the technology has helped hugely. And with the digital scanners that we have in practice, we can do a mock-up like that in minutes.
Really?
It's brilliant. Wow. It's something that's really has just changed the landscape over the last few years for dentistry. And yeah, it's a fantastic tool.
Brilliant, excellent. Well, tell me, you are based in White Abbey, is that right?
I'm based in White Abbey in County Antrim. It's in Dental Clinic.
Sorry, for some reason the mic didn't pick that up. Abbey Dental Clinic, yeah.
Abbey Dental Clinic, yeah.
Good. Didn't sure know if you said Abbey or Happy, you know. Right, and how do people get in touch?
Oh, so you can get in touch in a number of ways. So you can telephone us in the old-fashioned way at 028 9085 4014. Our website is abbeydentalclinic.com, and we have an Instagram page as well, Abbey Dental Clinic, and it's all accessible, and they're all ways to see what we're about and to get in touch with us. And any of those avenues is fine.
And as we said before, do it as soon as you can, once you know you want to.
Go as soon as you can. You might find that you don't need much done. It won't take long, but other times, you just need to buy yourself in a little bit of time and try and get things done before the day before the big day.
Well, apart from coming early, have you any other advice for the upcoming couples?
Enjoy your day. I mean, it's not very exciting, but I remember my day was fantastic. I had a great time, and there were so many things that you worried and stressed about, and you just didn't have to. I mean, you're doing something that you hopefully really want to do, and you've hopefully, COVID regulations notwithstanding, you've as many of the people that you want to be there as possible, and you're just there to have a great day and just enjoy it as much as you can, because it's over in a flash.
Oh, well, that's very, very true. Yeah, becomes a memory very quickly. Conall, it's been a pleasure. I have learnt a lot of things I didn't know. I think that most people listening to this would be in exactly the same boat. I also think that the stuff you've told us has painted a new picture in people's minds about what can and can't be done, and also about the technology, which is certainly making the patient more involved, which is brilliant. In fact, I don't even know if you call them patients when they're coming for orthodontic treatment, but it would be more, I don't know, what would you call them really? I mean, there's nothing wrong with them, they're just changing.
No, everyone's a patient, but you know what, it's nice in terms of whenever people come in for reviews, and you do start to build up a bit of a relationship with people when you see them more regularly, and it is nice to see the change. And they're usually nice appointments for us as practitioners, and hopefully for patients as well. And it is nice to see the change, and it's one of those things that it is really, again, it sounds a bit trite, it really is lovely to see someone happy, and it does it can turn for us, it can turn a bit of a long day into a very good one when someone says they're happy with their treatment and they're happy with how they look, and that's a good boost, I always think.
Funny, the one word we've neglected to mention, and I think it's very important, a good smile can give you an awful lot of confidence. It really can build up a person's confidence completely out of the room altogether, brilliantly.
Yeah, I mean, I've seen it so many times over the years. You make changes, and they can be very minor. I mean, sometimes even as a dentist, you're thinking that this is not, it's not a big deal, but it maybe something has bothered someone for a long time, and then they come back in, for the review, and they've had their hair done, and they're dressing a bit better, or holding themselves up a little bit. It is astonishing how much it can change. It can just remove that little niggle from people, and it's one less thing to think about and worry about. And we see that all the time. Yeah.
I said it just came to mind there, but I know it does happen an awful lot. Well, listen, Conall, it's been great. I've thoroughly enjoyed it. Thank you very much for coming on. And if anybody wants to get in touch with you, all the details will be attached to the podcast as well. So, folks, that's it from this episode of the Wedding Podcast. So from Conall and from myself, I say goodbye until the next time. All the best, folks.